Hello, my name is Lena Papadakis, and I am a research coordinator collaborating with Dr. Yonker in the Department of Pediatric Pulmonary Research here at MGHfC. The study that I will be discussing investigates the use of Larazotide for the treatment of multisystem inflammatory syndrome in children, also known as MGHfC. MGHfC is a rare but serious complication seen in children who have a known prior COVID-19 infection or exposure. Patients often present with a persistent fever, laboratory evidence of inflammation, and symptoms of multi-organ dysfunction. To date, over 6 million children have been diagnosed with COVID-19, and over 5,000 children have been diagnosed with MGHfC. And by the time you listen to this presentation, these numbers will already be outdated. In the early days of the pandemic, the cause for MGHfC was elusive to many. However, work done by Dr. Yonker and her team helped discover that COVID-19 particles remain in the gut of children with MGHfC for a much longer period of time. Specifically, these elevated levels include significantly higher levels of spike and S1 proteins, as well as SARS-CoV-2 RNA in stool samples of children with MGHfC. These children also displayed high levels of an inflammatory marker called zonulin, which is known to increase intestinal permeability via the breakdown of tight junctions. As a result, increased gut permeability allows superantigen-like COVID-19 particles to enter the bloodstream and trigger a systemic hyperinflammatory response. To date, treatments for MGHfC have remained largely supportive in nature. However, Larazotide, a zonulin antagonist that promotes the maintenance of tight junctions, has shown promise when trialed in MGHfC patients under compassionate use agreements. In these patients, Larazotide successfully decreased the level of COVID-19 particles, and it was also noted that symptoms, especially those localized to the GI tract, improved faster during Larazotide treatment. As a result, the team has launched a study into the use of Larazotide as a treatment for MGHfC. The study aims to enroll 20 participants who meet MGHfC criteria, and subjects will be treated with Larazotide or placebo 4 times daily for 21 days. Over the course of the study, biospecimens will be collected to monitor changes in clinical and inflammatory profiles. Patient and caregiver questionnaires will be given to assess changes in physical health and symptoms. The primary objective of this study is to evaluate safety and efficacy of Larazotide versus placebo in patients with MGHfC. Given Larazotide acts locally in the gut, the primary endpoint is to determine the proportion of participants with improvement in MGHfC-related GI symptoms. Numerous secondary and exploratory endpoints assess clinical and laboratory-based improvement in MGHfC symptoms. As for next steps, we will enroll patients at MGH and analyze safety and efficacy data before initiating a phase 3 study. Pending promising results in phase 2 and phase 3, we hope to eventually pursue an EUA pathway for Larazotide as a treatment for MGHfC while seeking full FDA approval. Overall, treatments which promote maintenance of intestinal tight junctions offer a promising new avenue for the treatment of MGHfC, and we hope our work will continue to improve outcomes and inform the standard of care for MGHfC. Thank you.